One-stage exchange, who's indicated and how we currently do it. I do not have any disclosures that are specifically relevant to the talk. This doesn't seem to be advancing here, guys. I don't know if the battery died or...
Charlie broke it. He was pushing it too hard.
There we go. These are my disclosures. I don't have any disclosures that are specifically relevant to this talk. So why are we talking about single-stage exchange in the first place? And it's somewhat sobering if you go back and look at the success of treatment of periprosthetic joint infection over the past 20 years and divide it up into the previous 10 years versus the most current 10 years. Really what we see is no dramatic shift in the improvement or the success for treating periprosthetic joint infection, which is pretty sobering. And I think in Europe, no question, they are starting to look at single-stage exchange as being the gold standard for the treatment of periprosthetic joint infection. So I think it merits further evaluation in the United States. What are the potential advantages? Well, there's certainly an economic advantage with decreased overall cost to the healthcare system and to the patient. Theoretically, a lower morbidity, improved stability of the limb because they don't need an interim period where they have a static or articulating spacer in, which in turn should lead to shorter disability. And no question in any cost effectiveness or economic study that you look at, if the results are equivalent to a two-stage exchange, a single-stage exchange dominates in every single one of those areas. But there are some challenges that remain with single-stage exchange. It's a big lift, and I'll touch base on that just in the surgical technique. And if you lose, you potentially lose big. Think about it on the knee side. If you're cementing in stems and you have cones in and that patient fails, and you have to go back and take all of that out. And there's still a lot of unknowns that we're dealing with that are trying to be elucidated in some of the studies. Lack of high-dose antibiotic delivery, antibiotic duration, how long should these patients stay on antibiotics afterwards. So the classic indications have historically been a known organism, avoiding resistant organisms, culture negative and fungal.